Hello and welcome to Western Perspective. I'm Nelson Liu. We'll have AMA WA President Dr Andrew Miller's commentary coming up in just a moment. But first, the federal government is rolling out COVID-19 financial support packages for businesses big and small. But with a range of support for those hit by the pandemic, there are lots of questions about who will benefit the most. This week we break down the details with tax accountant Nitin Vashisht on how the payments will affect small businesses, particularly young people who own their own business. Nitin, thanks for your time. So what are the payments and who is eligible for them?
Well, thanks, Nelson. The payments in this new stimulus basically fall under three broad categories. One is to help employers with their immediate cash flow. The second is to help the employers keep their employees in the jobs. And the third one is basically as an incentive to businesses to spend and invest in the future of those businesses by way of giving them tax incentives and tax concessions.
What can businesses expect from the stimulus?
Look, the business can expect the temporary cash help to tide them over this crisis. Now, first cash help that is available to them, Nelson, is what is being popularly known as the Cash Boost Scheme. Now, if you are a business that has a turnover of less than $50 million and it is broad, and you were already in business as of 12th of March 2020, which means you are not a new business, and you are an active employer. What that practically means is that you have employees on your payroll. So if you satisfy any of all of these three criterias, then you are eligible for the Cash Boost Scheme. So what it effectively does, it pays you $20,000 and up to a maximum of $100,000 in cash. And that is a fair bit of help for businesses. Now, you don't need to do anything extra to be able to access this extra cash. It will come to you through the usual BAS system. All you need to do is just lodge your BAS in time, and the credits or the refunds will come to you through the BAS system. Now, if you lodge your BAS quarterly, you will be getting these payments quarterly. Now, and if you lodge your BAS monthly, you will be getting them monthly. But you must have employees on your payroll, and it will be based on the PAYG tax that you withhold from the salary of your employees. But don't worry, if you are an employer who have employees on your payroll, and you are not required to withhold tax because maybe the employees are below the tax-free threshold, you will still be eligible for this Cash Boost Scheme, and that can help you anywhere from up to a minimum $20,000 to $100,000.
What about young people who own a small business? What will it mean for them?
Look, the young people who own businesses are covered by the new JobKeeper scheme. Now, the JobKeeper scheme is basically designed for businesses to help them to keep their employees in the jobs, and I'm particularly happy that this also now covers sole traders and self-employed people. Now, Nelson, you know, a lot of young people are self-employed. A lot of young people who run small businesses are self-employed, they're sole traders, they're trades, they do the small jobs as sole traders. Now, these people are now covered by this JobKeeper scheme. What it effectively means is you may not be having any employee, and you might be basically your own employee in the business, and you will still be covered for the JobKeeper scheme. Now, how are you eligible for that? How do you know you're eligible for that? Now, you will have to prove that your business has had a decline in the turnover of 30% compared to the previous periods. Now, if you are able to demonstrate that, then you would be eligible for this JobKeeper scheme. And what it pays you is $1,500 a fortnight per employee. So if you are a small business, Nelson, and you qualify for the scheme, and you might be just working for yourself, so that can give you nearly $3,000 a month for yourself, which is a fair bit of help.
Will this help young people keep their jobs?
Look, Nelson, absolutely. This will help young people keep their jobs. Not only the people who are self-employed, this will help them to to continue to work through this period and come out better the other side. But even the young people who are working for other businesses, so the JobKeeper scheme will definitely help. This $1,500 per employee per fortnight will help the businesses to keep their staff employed. And also a lot of young people, Nelson, are basically apprentices and trainees. Now, the businesses are now eligible for 50% wage subsidy for employing apprentices. So that can give the businesses up to $21,000 for a 9-month period to cover the cost of apprentices. So this will definitely help young people keep jobs.
Employers and employees are going to have expectations about what this payment does, but is there anything they shouldn't expect from this?
Look, the first thing I would say that the employers and employees should not be expecting to profit from this scheme. Now, what that means is, say for example, the JobKeeper scheme. So employers who are getting $1,500 per employee per fortnight are expected to pass on these payments in full to their employees. So say for example, an employer is having an employee that they are paying $1,000 a fortnight. But if they get a $1,500 a fortnight payment from the government, they are expected to pass on the full $1,500 to the employee. They cannot pocket the $500 payment. They cannot profit from that. And look, the other thing the businesses should not expect is that this is a temporary scheme. Now, this is a help. This is a help given to the businesses during this period, but the businesses have to recalibrate their own strategy, and they will have to use this cash flow and this help wisely to strengthen them to come out better on the other side. And the third thing I would say, Nelson, is that the employers need to assess their eligibility for the scheme a little bit carefully and not rush into it before they start committing to their employees.
Nishan Vashish there. Well, the coronavirus is continuing to take hold in WA and around the country, affecting healthcare workers as well as those infected by the pandemic. AMA WA President Dr Andrew Miller has his say on the developments this week.
Hi, Sunday afternoon. Just wanted to give you a quick update on the things that have been important where we're at leading into the week ahead. Got a couple of notes here. The better numbers are really gratifying to see, and congratulations, unreserved congratulations to Mark McGowan and his government for now making Western Australia one of the best places in the world as far as social controls are concerned, and border controls certainly, and getting people working from home, getting school students learning from home and uni students. This stuff has all been very hard, and it's all been done in a very short space of time, and we have enormous gratitude for the government. We've had our bumps along the way. Few bruises were inevitable, but we really appreciate you locking things down as much as you have, and the travel restrictions are now starting to see that 10-day to 2-week lag and the more gratifying numbers that are coming through, which all buys us time as we sail into the storm, and will make us hopefully one of the places in the world that manages this in a way with the minimum amount of mayhem, destruction, infection of healthcare workers and unnecessary death of patients. So all of that has just been fantastic, and you get the real sense that the community is starting to understand it now. Well done in particular to Joondalup Health Campus taking on a big load of those patients from the cruise ships. I know that the team there is working really well together, stressful, difficult conditions, and doing a fantastic job. So thank you for taking those cases on. In terms of preparation and training, public hospitals are doing really well. They're quite advanced with their teams, and although there's still shortages around the personal protective equipment, we have some green shoots and some confidence that we'll be able to improve on that by the time the big caseloads hit. We think that it's fantastic that Twiggy Forrest has done what he's done. Our first load's all been cleared with very few exceptions, and the AMA will be helping in getting that out to the non-hospital sector, so that we can provide some reassurance to aged care, general practice, other specialists who don't work in hospitals. Get in touch with the AMA, and we will help coordinate the delivery of that and future loads that are coming through, which incidentally will be not just for here but for the rest of the country, we're hoping. congratulations to the government on getting the Guardianship Act and all members of the Parliament, the upper and lower house. Very thoughtful, very considered approach, went into a lot of detail, and this will allow trials of new therapies for COVID patients and other patients, incidentally, in the intensive care units and EDs in Western Australia. Brings us into line with the rest of the country and means that you and your relatives, your friends, will be able to try the same new therapies for this horrible condition as everywhere else in the world. In terms of the guidelines around PPE, a bit of friction there in some hospitals and settings and general practices. What we're asking is don't get into fights and arguments about who's allowed to wear a mask and who's not. We're happy to be involved in helping facilitate those discussions in a civilised fashion so that everyone can keep working, everyone can feel safe. There's two aspects to what gear you need to wear. One is the clinical situation. How likely is it that the patient has the disease? Well, testing is very important there. More and more testing is going to be important, and we need private pathology testing to come in and help us out. They're the big guns. We need to be testing every patient who comes into hospital for whatever reason so that the healthcare workers there know what it is that they're dealing with, and we'll have a lot more confidence that the PPE level they've been granted in these times of a bit of short supply is going to do the job for them. Because they know as well as anyone else that if you're unwell as a healthcare worker, you not only can you not help anybody, you become a burden to everybody, and we don't want to do that. But don't have those arguments. Contact me, contact the AMA if you feel that things aren't being done right, and we'll get through it in a civilised sort of fashion. And we'll have those guidelines a bit better sorted out as time goes by. As I said, the first aspect is the clinical aspect. What's the likelihood the patient has it? What's the likelihood you're going to get exposed by what's going to happen there? The other aspect is the vulnerabilities of the healthcare worker, and those are both physical and in terms of mental health. So someone who has a partner who's on chemo at home, we have to have a little bit of understanding, compassion and empathy that person may actually need to be using a bit more gear in order to function properly in their job throughout the day and still live their life when they go home. We're all humans. We're not disconnected. When we take the scrubs off and we throw those into the wash and we get into something that we can actually wear into our house, and we hope and pray that we haven't brought anything home that we shouldn't have. Those things are hard things to put down, and anything that the system can do, anything that we can do to support people in this time, I think we should do. I was really touched today by something that Dr. Jardine from the Children's Hospital shared with me, a video which I'm sure many people have seen from the UK of an ICU doctor addressing the vulnerable people. And a lot of the conversation we've had around COVID has been, well, don't worry, this is something that only affects the frail and the elderly and those with chronic disease and disability. Apart from that not being true, in fact, we're seeing that although they're smaller in number, young people can certainly be extremely hard hit just like anybody else from this disease. We just want to send a message to the people who fall into that category, the ones who might feel a little bit like they've been forgotten, that you haven't been forgotten. Your doctors, your nurses, your allied health, everybody else are still here for you. We will do everything for you that we possibly can. And one of the big reasons we're delaying all this is, of course, the hope of better treatments and a vaccine. We value every human being. We don't care where you come from, what you look like, or what's wrong with you. We'll do our level best to make sure that we can be there for you. We won't give you treatment that's futile. We won't do things for you that are harmful, but we will give you full support. And if worse comes to worse and you get this disease, we will still treat you. We won't forget about you. We will hold your hand. We'll be there with you. And that's the message from doctors all around the world and nurses and everybody else, that we still care very much about all of this. And one of the reasons we're locking it all down is to try and get to a place where many of the treatments and the vaccines around the world that are being developed can actually be delivered. We're starting to see masks and ventilators and things being manufactured in Australia. Just a few more weeks we'll get some of those things online. So thank you all for your patience with this shutdown, and we know this will be a time none of us will ever forget, but let's make that for the right reasons, and appreciate your time today.
And that's all for Western Perspective for this week. Thanks for watching. We'll be back again at the same time next week, but for now, it's back to you, Ivan and Sarah.
Thank you, Nelson. This week's main news again. Advocates are demanding the McGowan government get WA's homeless people off the streets now, calling for better protection for them as the COVID-19 pandemic sweeps the state. Activists claimed as hotels sit empty, trialling the program before starting is not necessary, and they want the trials to be dropped.
And that's our weekly news and current affairs. We have the latest news on our website and social media pages.
Until next Sunday after 8 p.m, look after yourselves, stay at home and have a pleasant evening.
Take care.